Health research is more likely to make a difference when people most affected help shape it. But meaningful participation doesn't happen automatically, and it's understood and applied in different ways. My name is Helene Meri, and I'm part of REAL2, a Wellcome-funded realist review looking at participatory action research in health. Participatory action research is where people most affected by health conditions are involved throughout the research process, from setting the research questions to analyzing findings and acting on them. We draw on the published literature, including the fields of infectious diseases, climate and health, and mental health, grey literature, alongside insights from researchers, practitioners, and relevant theory to understand how these approaches work in different contexts. This matters because while there has been significant investments in participation and in community engagement, there is less clarity on what makes it meaningful and what helps it lead to action, impact, and equity. Our previous research showed that relationships between communities and researchers are key, but these relationships are also shaped by differences in wealth, power, and context. In REAL2, we're exploring what happens when research explicitly tries to share power more equally between community members and academic researchers. We're looking at how power can be shifted at different stages of the research process, from deciding what needs to be researched, to how partnerships work, to what happens with the findings. We trace how participatory action research, through cycles of action and reflection, can contribute to personal empowerment, community benefit, and more equitable policies. To enable the promise of participatory action research in health, we need a careful consideration of power. This helps sensitize researchers to existing power dynamics and centers action on issues that matter most in people's daily lives. Ultimately, this can support social innovation and contribute to greater social justice, human flourishing, and planetary well-being.